Welcome back to the Morning Blend. As if pregnancy doesn't do a number on things already to our body, it can also cause something called melasma.
Dr. Deborah Manjoney is here from the Wisconsin Vein Center MediSpa with a few treatments for this cosmetic problem. Good to see you.
Thank you.
Morning.
Good to be
Some
back.
people probably don't know what melasma is,
Right,
and so maybe
melasma is
describe
just,
it.
Well, it's a dermatitis or an inflammation of the skin that causes discoloration in the skin. So hyperpigmentation, a darker pigment that can be either very sharply defined or kind of just fuzzy around the edges because it depends on what level of skin it's located in. And it often can happen during pregnancy, but it can be related to a number of different things.
What color is it? Is it like
It's brown.
Yeah,
It's
okay.
brown. For the most part, it's a browner color.
It tends to be hormonal.
It tends to definitely be hormonal, and almost everybody who gets it is a female, but it can affect about 10% can be men.
It can be the face,
Can be
neck
the
or
face,
chest.
right.
It
Neck
can be
or-
disfiguring even.
It can really be disfiguring, and especially in, for instance, in Asian skin, in darker skin where there's a lot of ultraviolet light, because that's the other part of it. Ultraviolet has to be there in order to cause this to happen.
Okay.
So sunlight. So people who are out in the sun a lot or aren't using sunscreen, this is much more likely to happen in.
So this is not the same as when you see a white blotchy spot on
No,
someone's skin.
no.
That's different,
That
right?
is
It's
totally
the
different.
tanner, blotchy parts.
Right.
And some women get it when they're pregnant. So we
Yes.
kind of said, you know, here's the deal. Pregnant women, they've heard of the mask of pregnancy.
That's correct. And either they get like a mustache or they get a butterfly type of appearance of this darkness. Now, in some people, it goes away when the hormonal changes are gone for about a year. But in the majority of people, it doesn't go away. It's a more permanent condition.
So
Really?
it's not curable, but
Right.
there are treatments.
There are definitely treatments, and there are more and more good treatments now that don't use just hydroquinone as a bleaching agent, which is what the tried and true thing was for years, except that can cause complications on its own. So this is a treatment we had done using microneedling on the lip, the upper lip, with something called tranexamic acid, which is now a topical we can use. It's also used orally in pill form in very, very low doses to achieve good clearance. And also we can use for certain ones either intense pulse light or we can use certain lasers and things that we have that by delivering the laser energy without a lot of heat, we can go to the depth of skin we need to, because heat is another thing that's bad for melasma.
Right.
So
Because the sun can exaggerate it, as you
right,
said.
and that's why intense pulse light can sometimes be bad and make it worse. And even though we love to use that treatment, we try to stay away from it in people with melasma.
That's good to know.
Yeah, so you have something new that's called Laze MD.
Right.
You mentioned microneedling,
Right.
you mentioned intense pulse light. There are peels sometimes that
Yes.
work. And what I wonder is when someone comes in and they present with this problem, they're not going to know what treatment would be best for them.
Right.
And that's where you guys come
Right.
in.
We'll evaluate their skin. We'll try to figure out just what the depth is. And especially like with this new Laze MD that we have, we're able to treat at a very mild level, see how somebody responds, but we're also able, because what this laser is what we call a thulium laser, and the wavelength itself is non-ablative, but we deliver it in a fractionated way. So we're making like little channels like we've talked about before with some of our other procedures, but they're channels that spare the outer surface of the skin. And it's what's called non-ablative, so that we can then put something on the skin and it gets sucked in basically into the
Okay.
deepest layers of the
You're
skin.
like aerating the skin.
Yes, but not causing a lot of external injury that you
Yeah.
can see. But yet it does allow products to penetrate. And this actually comes with an FDA-approved tranexamic acid substrate that we can use on the skin afterwards to really create wonderful change.
Is it really meant for melasma?
One of the treatments is, absolutely.
Gotcha.
Yeah.
And I wonder too about moving forward. So you help people decide what treatment
Mm-hmm.
might be best at remedying it. Again, not curable, but really treating it, having it go away. But then you need to make a commitment.
You do.
Probably as it relates to not just
Absolutely.
the sun, but
Right.
also the products you use,
Yes.
using sunscreen and using take-home products that block
The
that.
production of the pigment, the melanocyte. Melanocyte is the cell in the skin that makes the melanin or the pigment that gets so brown.
And
So
you
wanna
have
try
those
to block
products.
it. Yes, you want
Okay.
to try to block it at different levels. And so to try to get rid of it permanently or not be affected by it again, you do have to commit to using some kind of products on a daily basis. Certainly the number one thing is sunscreen. And it needs to be, even though we say to everybody you need to use sunscreen every day, it's extremely important in melasma to use sunscreen every day, and actually to avoid the hot sun during the summer and during different times of year.
to prevent that re-stimulation and that
Right.
production of melanin,
Melanin.
which is essential.
Right.
The Wisconsin Vein Center and MediSpa does complimentary consultations. Their office is beautiful. It's a spa located in Pewaukee on Georgetown Drive. Make an appointment today, 262-746-9088, or go to their website to learn more. WIMedispa.com is the website. Always great to see you.
Nice
Thank
to see
you.
you, and we're excited that we can offer something for these
Finally,
problems.
right?
Yes.
Yeah, absolutely.